right, guys. Hey, switching gears here. Now, memorial services are being planned for Prince as the investigation into his death continues. I know there's been, the first memorial service, but a lot of other things have been planned as well. Prince's family members say they are planning a service to remember the late singer in the very near future. Reports say prescription drugs were found on Prince when he was found dead inside his home in an elevator. Now, it's still unknown if the superstar had an addiction to painkillers. And actress, of course, Jamie Lee Curtis understands Prince's situation well. She was once hooked on the drugs herself. Fortunate for her, though, she has been clean for close to 20 years. Now, here to talk about addiction and treatment and how you can help a loved one is Chris Gordon from Solutions Recovery, where he helps teach young people the dangers of addiction and drug abuse. And Chris, thank you so much for being here. You've been doing this for about 30 years now.
Well, I'm in recovery 30 years.
Yeah.
I've been working with Solutions Recovery for better than 7 years.
Yeah, wow, that's a long time. Okay, hey, let's get to the first question. When someone famous dies, it opens our eyes, a little closer to home. What would you say are the key signs we might not know to look for?
Well, with prescription medication, it's tricky sometimes because, again, justifiably, the doctor is writing the prescriptions. But weight loss, obviously, irritability, depending on the situation, sometimes, the medication will be gone prior to the next prescription. So we might see items being pawned or sold or things like that if we're talking about the youth primarily.
Yeah, and you know what? One of the things I find very interesting, just looking at Prince, I mean, the guy was 57 years old. I had a father, Chris, who was alcoholic and a drug addict. There is a look. There's a definite look of someone who's abusing drugs. Prince did not have it. That's just my opinion. What's your opinion?
Well, I can't speak on that particular topic, but I, maybe being that I've been in recovery a long time and I work in this industry, I can usually tell.
Yeah.
With opiates, pinpoint pupils is kind of a telltale sign. Again, irritability. We see rapid weight loss quite often.
Oh, yeah. All right. So what's the most effective way to approach a friend, a college, family member, if you suspect, because this is a very delicate situation?
It is. It is. And I think that sometimes, again, quite often people are going to get very defensive.
Yeah.
If they've been prescribed medication due to an accident or a surgery and they have legitimate pain, but again, tolerance is such where it takes 2 to do it, 1 did, 4 to do it, 2 did.
Oh, wow.
So, to approach someone with love and kindness, obviously, but if it gets to the point where it's being, sometimes the families are being held hostage to the addiction.
Absolutely. A lot of enablers in the families as well.
Correct.
So who is the typical profile of someone hooked on pain meds? What are you seeing in your facility that might surprise us?
Well, I would say our demographic is probably 18 to 30-year-old entitled youth. And again, entitled isn't necessarily a bad word. It means that we love our loved ones, but addiction as we know it really can't be loved to health. It can't be loved better. So we have to kind of take a loving but firm approach.
Yeah, and so anyway, folks, hopefully this helps you out. Chris, that was some really good information, and congratulations to you, 30 years.
Well, I'd like to tell you I'm sober 30 years, but I'm sober now a little better than 12 years, but I've been in recovery 30 years.
30 years, very good.
Cat's out of the bag.
Hey, let me tell you, congratulations. That's a huge accomplishment.
Well, thank you very much.
We appreciate it. All right, and folks, flipping the script here, Rachel, over to you.
All right, well, guys, did you get a chance to check out